Ethical considerations continued. Ethical guidelines for doctors. Abuse. This includes child, elderly, and intimate partner abuse. All 50 states mandate reporting of child abuse. Most states have legislation regarding elderly abuse. Reporting abuse of intimate partner is not so clearly defined, however. This may include rape, which is a reportable crime. Often covers stalking. Child abuse and elderly abuse is mandated by the medical assistant and by the physician. Abuse, we must protect and care for the abused. However, we must treat the abuser as a victim also if they have been injured. Treatment, provide a safe environment for the abused seeking treatment and seek treatment for the abuser and the abused. Bioethical dilemmas. Strive not to place moral values upon patients. We have allocation of scarce medical resources. Medical resources are still not available to everyone. The American Medical Association says more than 6% of children still do not have health care. The average wait time by new patients for medical appointments is about 14.5 days. Macro allocation decisions are made by Congress in healthcare system agencies and insurance companies. Micro allocation decisions are made by physicians and local healthcare teams. Abortions and fetal tissue research. There's constant court challenges to the validity of Roe versus Wade. Their state restrictions vary, but abortions in the first trimester are still illegal without interference. Healthcare providers are not required to perform abortions. The use of fetal tissue to benefit patients with life-threatening diseases is more and more common, but still does come with some very big controversy. Some states have laws that prohibit the sale of fetal tissue. Fetal tissue research is not to be used to encourage abortions. Umbilical cord blood research shows some promise. Genetic engineering and manipulation. Potential for identifying genes that predispose certain illnesses and for altering those genes. Cloning shows promise in making certain organs, but is still very controversial. Artificial insemination and surrogacy. Sometimes the only way for some people to conceive. It encouraged meticulous screening. Both mothers and fathers can be a surrogate. In vitro fertilization has been increasingly used in reproduction. Often embryos are created and saved for future use. Genetic screening can be performed on these embryos prior to implantation. Dying and death. Patients are making more choices. An example, the Karen Ann Quinlan case and the Terry Scalvo cases. Those were two cases that were held up in courts for many years on whether those two young ladies could be taken off of life support. Physician-assisted suicide legislation. Oregon passed this legislation in 1994. Other states have considered similar actions. It becomes a quality of life issue. Hospice makes individuals comfortable and as free of pain as possible while giving dignity to their death. It's often covered by insurance and less expensive than inpatient hospital care. HIV and AIDS. The public fear is reduced in some recent years. The confidentiality of these people are still very essential. You must protect the public and the person with HIV and AIDS. Encourage the HIV person to cease endangering others. The provider can contact authorities who will notify any persons at risk. And there are partner notification programs.